Hello friends. Well, today we are going to talk a bit on research. The moment we say research, we all are a bit skeptical about a lot of domains. What will I really do? Will it really be a possibility for me? Am I really capable of handling this? But the thing is, research has been a part, or rather it is right now a part and parcel of everything that we do. As a graduate or even as a postgraduate student, doing a physiotherapy research in form of a dissertation or a thesis is a mandate for all of us. Most of us do it maybe unhappily just because we are supposed to do them, or most of us really like it and we do it. We have also many of our undergrads who even in their first year of bachelor's in physiotherapy are very much interested or inclined towards doing something new. So what is this physiotherapy research all about? So today we are going to talk about physiotherapy thesis, challenges, common fallacies, and means to overcome them. I am Dr. Apurva Shilpi. So what is it about physiotherapy research? Now, if we are looking at our profession, physiotherapy is a healthcare profession which is concerned with human function, movement, and maximizing the potential of an individual. So essentially, we are in a healthcare profession where we are looking at functional betterment or enhancement of our clients. We as physiotherapists use physical approaches to promote, maintain, and restore the physical, psychological, and social well-being of our clients, taking into account the variations in the health status of our patients. So when we are talking in terms of a professional development, as a physiotherapist, we are involved in administration and interpretation of the tests that we do, the clinical domains or so, especially for the body functions and structures. And we are also looking at provision of a range of therapeutic or preventive measures to reduce the patient suffering from disabilities, dysfunctions, and pain. But if we are looking at our own domains, by large, our profession is a specialty wherein calculation of specific dosages of modalities is still a challenge. And there is still a lot of research that is being done to understand the exact or specific dosages required in treatment, restoration, and prevention of the conditions. For example, you are treating a patient for lateral epicondylitis, or as we say, extensor tendinopathy. I am expected to give ultrasound or laser or iontophoresis. Okay, we say we have evidences to talk about it. Very good if you're looking into evidences. But let's say you look at ultrasound. What should be the dosage? Should I give continuous torque pulse? Should I give at 0.8 watts per centimeter square or 1.2 watts per centimeter square or 1.5 watts per centimeter square? Now the answer we really get at this stage is, again, it depends whether it is acute or chronic. Fine, let's assume it is chronic. Then what do we do? Continuous or pulsed? 1.5 watts per centimeter square, 1.2 watts per centimeter square, or 1. So this specificity is still a matter of understanding, and it is required that we as physiotherapy professionals understand the domains. If we are talking in terms of exercise therapy, we usually give the dosage in terms of FITT. But frequency 3 to 5 days a week. Why not exactly 3 or 5? Okay. Again, we say, no, there are lack of evidences or there is no documented proof. Well, that's exactly a scope of doing a research. And that's the reason why I'm saying research is not something which is very hi-fi, which is very challenging. Research is something very basic that we talk of in our day-to-day practice, that we understand in our routine scenarios. And hence, doing research in our profession is a very, very important domain. So there are many times some of our students who come and tell us, sir, I'm not so intelligent that I can do research. Well, guys, research has nothing to do with your intelligence. Research has to do a lot with your dedication and hard work. You have to follow a procedure. You have to follow a protocol by which the entire process of a research can be done in a very good manner. So what are the challenges faced by all the novice researchers? Today's session is directed especially to the graduate and the postgraduate students who are frequently worrying about what should I do, what topic should I take, am I really able to do something? So let's look at what are the challenges that we encounter. First, as we said, exposure to research. Not many a times students are seeing their seniors or teachers doing some standard research, and that's why they are not well aware of it. Second is the fact of interest in research, because we again feel that research is something that not just my cup of tea. Then there's a lack of understanding of evidence-based physiotherapy. We these days are talking a lot on evidence-based practice, and when we talk in terms of postgrads or PGs, we do expect all our postgrads to understand what is evidence-based practice. There's a difference between evidence-based and evidence-biased practice. But if we are talking for an undergrad or graduate student is merely looking at the current texts or literatures. And in fact, there are many who don't even want to read standard textbooks. They just want ready-made notes. If you are not in a position to understand what is evidence-based practice, how can you really understand research? And that why you require this evidence-based practice is because tomorrow when you're treating a client, you're seeing a patient, you need to know what you're doing is right or wrong. What you have been told, is it the truth? So you have to ascertain yourself, for which you do require an evidence-based practice and a skill to do a critical review of literature. As I said earlier, many of us do not do a critical review of literature. We merely followed guidelines or texts. Whatever was given in the text, I am following it. Why? Why are we not questioning ourselves? Why are we not questioning our own knowledge? Because we do not question our own knowledge, then somebody else does it for us. And we land up saying, oh my God, he's asking me too many questions. So learn the skills of critical review of articles. This evidence-based physiotherapy and critical review of articles are two topics by themselves, and we'll be more than happy to have this as successive sessions in the later stages. Third is a perceived role as a clinician rather than a researcher. Most of us are very much interested in clinical practice. Well, there's nothing wrong with it. All of us are all hardcore clinicians to start with, because without being a clinician, you cannot become a good academician. Without being a good clinician, you cannot be a good researcher. But a good clinician is always a good researcher, because as a clinician, you learn to question whatever you are doing to understand whether it is right or wrong. I am giving a treatment modality, or I am giving a manual therapy technique A versus manual therapy technique B. Which is more better? Well, your experience can also tell it. Your clients can also tell it. And your evidences can also tell it. This is what basically evidence-based physiotherapy is all about. So we generally pursue our role as ourselves as a clinician rather than considering it or considering ourselves as a researcher. But the fact is, if you are a clinician, you need to be a very good researcher. Oh, one more factor is aversion to dissertation work. Who is going to write those pages and pages and pages of stuff? Well, writing of a dissertation is like writing a novel. If you like to read a storybook, writing a flow of your thoughts from introducing your topic to writing the procedures to writing why you have got this particular results and explaining the rationale is like writing a novel. I understand not everybody is a good writer, but it can always be a collaborative effort. But most of us are having an aversion, a phobia of doing a research work or a dissertation work. Many times we have lack of logistics and infrastructure. I want to do something, but I don't have the tools, the measures, the scales, the modalities, or the resources to do it. These are challenges that most of us face in a developing nation. But there are always means and ways to do it. If you do not have the standardized tests or a sophisticated laboratory to do things, there are always clinical applications or field applications of these particular procedures. For example, assessment of balance. You can do in a lab with the help of a highly sophisticated equipment. Similar for a same group of population can be tried on the field for a community-based application. So it is not necessarily that always you have to have a very high-tech equipment. Of course, if you have, it's wonderful. But if you do not have something, it does not matter, because what matters is applicability of your study. How are you able to actually use whatever knowledge you are gaining out of it? And hence, logistics and infrastructure can, be ignored in some way, because you need to look at what are your strengths rather than what you don't have. And last but very important is phobia of asking questions. Somewhere down the line, we all have been always told not to ask questions. Right from our childhood, when we are questioning something, many a times we are told, just listen to what I'm saying. Don't ask me this. Why? As a student, as a doctor, as a therapist, as a scientist, asking a question is your fundamental right. If you can't ask questions, you can never do research. But most of the times we are even ignorant, or we are even having a fear. What will people say if I ask this? Something as simple as this. For example, the example that I gave earlier, should I give ultrasound at 0.1 at 1 watts per centimeter square or 1.5 watts per centimeter square? Why are you scared of asking this question? It's okay if you don't know. That's when you will try and find out. That's when you will research on it. So ask a question. Asking a question actually helps you grow. Because if you're not asking a question, you will be stagnated with the same knowledge or the same texts that all of us have been reading for the past 10, 15, 20 years. So where will you grow ahead with? Okay, so asking a question is very, very important. That actually brings us to the most important component of any research, the research question. To start a research, you have to have a base on which you build up everything. And this base is called as the research question, which is the soul of every research, every thesis, every dissertation. It is the fundamental domains. Why is this particular treatment better than the other? Why are patients involved with these activities doing better than the others? Why are diabetics more predisposed to having so-and-so issue as compared to non-diabetics? Asking a question can help you gain an answer. Well, let me remind you once again, ask the question first to your own self. Try and find out the answers, read through texts, read through recent literatures. If you are not able to find answers to your questions, please talk to your teachers, your guides, or your mentors. They are always there to help you. Okay, let's say your guide or your mentor or your teacher also does not know answer to that question. They will read up thanks to you. Thanks to you and your question, we all will also grow and progress, and the profession will grow and progress. So asking a research question is very important, because it not only directs the end point of the thesis as to what you are going to get at the end of the research, but also marks the pathway that is supposed to be taken towards completion of the thesis. Your research question will direct what study design should be used, what samples should be used, what outcome measures should be used. Your research question will actually direct the entire procedure. One research question will give you one study design, one outcome, or one particular domain. If you have two research questions, well, of course, two studies. Research question also helps to understand the contents of the thesis or the topics. As I just said, what methodology should be used, what tools or outcome measures should be used, what statistical tests should be used. It is not a very big domain. As a professional, as an academician, as a clinician, I was a bit skeptical about doing statistics or learning about statistics. Thanks to my colleagues and friends who actually helped me understand that when you know a bit about statistics, you can understand, you can explain to the statistician what is your need or your desire. What is it that you want to do? Well, my liking in statistics actually started building up to a domain where I actually started doing basic statistics for my own studies. And it really helps. These days, with the advent of YouTube, tutorials or so, you can get solutions to a lot of statistical questions if you're using good softwares. In fact, there are very good free softwares also available for calculation of your sample size or for your statistical tests also. For example, for sample size, G-Power, It's a free software which you can use. It's a very good software for calculation. A free software for doing statistical analysis, like for example, WinPep. Or if your institutes have good SPSS, that is also very important software. We also have some other domains. I'm just giving a few examples. We have like n number of softwares that are available free for all of us for doing statistical analysis also. So learn these domains. Research question helps to assess the gap in research, what you want to do or what has not been found out over a period of time. And it helps to anticipate pitfalls and potential benefits to the society. Don't do a study because you have to do it as a research or as a dissertation. Do it because it has to have an application to people. It has to have some benefit to the society. Well, the more you think what I should do, the more confused you get. But worry not. We are here to help you and to guide you to what can be done in a better way. After you have ascertained your research question, you need to lay down a basic hypothesis. Hypothesis is essentially a statement of a problem which helps in directing the methodology. You have a research question, the answer to it, the possibility of it is your hypothesis. Again, not necessarily all studies will have an hypothesis. For example, there are some hypothesis generating studies and there are some hypothesis testing studies. Many a times your cross-sectional studies or surveys that you do as a basic study is a hypothesis generating study. You do not test an hypothesis, it generates an hypothesis. Whereas many of your interventional based studies, case controls, cohorts or so, test certain hypotheses. For example, do people who smoke more have a higher tendency of developing lung cancer? My hypothesis, that was my research question. The hypothesis can be, yes, people who smoke cigarettes do have a tendency of developing lung cancer. Null hypothesis can be opposite. There is no relationship between smoking of a cigarette to development of a lung cancer. Because research is always about 50-50. You never start that I want to prove this, because the moment you say I want to prove this, you're inviting a bias right at the beginning. So always have a clear mind, have a choice. This can also happen and that can also happen. Both are possibilities. That would keep your mind open to do a clear, unbiased research. Look at a comparison. So hypothesis helps in making comparison between two or more groups. As I just gave an example, people who smoke versus people who do not smoke. Of course, people who do not smoke can also get lung cancer, but people who smoke may get lung cancer faster. Or out of 100, 70 of people who smoke can get lung cancer, and maybe 20 of people who are not smoking can get lung cancer. So you can develop your hypothesis based on your research question. Your hypothesis also helps in planning for data collection and management, determining the statistical methods for analysis, and estimating the magnitude of the expected difference between the two groups. What do I mean by magnitude of difference between two groups? Magnitude of difference is how much was a change and how much was it clinically relevant to my client or to my patient. This change can help us determine the sample size. Again, most of us, when it comes to sample size, want a ready-made answer. They want somebody to tell you, okay, take 30. Why this magical 30? Why not 20? Why not 40? Why not 100? So calculating a sample size will depend on whether you are giving interventions to both the groups. What is the change that you are expecting? What is the power of your study? What is the statistical deviation? What is the standard deviation that you are expecting between both? So understanding all this would actually help you calculate a sample size. So please don't expect that you ask your guides or your teachers and they give you a number. Okay, this is what the sample size can be. You have to look at previous literatures. If not, do your own pilot study to actually establish the magnitude of change. Okay, that would help you get the clarity. Next is the title of the study. Most of us First thing when you are asked by your guides or your teachers, okay, what would you like to do? First thing is we start talking of the title. Well, guys, the title is the face of your study. Give time to build it. Always, if you're asked what would you like to do, ask a research question. Sir, I would like to see whether giving IFT or ultrasound to the knee would be better in management of arthritic pain. Go for a question rather than I want to do a study of comparison between IFT and ultrasound for management of pain in patients with no. That really does not make. Give a time to formulate a title. Okay. So as I said, title should be clear, concise, and non-ambiguous. Your title should be understood by everybody. Whatever, it should express what you are wanting to do. It should create the desire to read the particular study. So title should always arouse interest. It's like you want to go for a movie. The movie, you look at the title and you feel, oh, I should watch this movie. It sounds interesting. So the title, the nomenclature of the movie, it's very important. Same way, the title of your study should arouse interest in the readers. If your title is confusing, first thing itself, people get deterred away from reading the study. Title can be a statement. Okay. Again, mind you, when you are talking of a dissertation, it generally is a different thing as against when you're writing for publication. Because when you're writing for publication, you already have got a clarity on what your results are. You already have got a clarity on what your conclusion is. So that title can be different versus a title for a dissertation or a thesis. Yes, you have a research question. Sometimes the research question can be a title. Can so and so help in enhancement of so and so? That can be a study title can be a research question. Your title can be what is the aim, but except that to, because the title should not have to find the. It can just be, for example, what you're seeing here, reliability and validity of a new test or so and so. So title can be like this. Your titles can be a performance statement of what is going to be done. Please remember, of course, this is beyond the domain of this particular domain, but we have something called as a PICOT, population, intervention, control, outcome, and time. An ideal title should involve these domains. Whom you are doing, what you are doing, comparing against whom, testing by what, and within what time frame, if applicable. So we call this as the PICO or the PICO format. Okay. Try and use this PICO format to formulate your research question as well as to formulate your study title. And if, as I said earlier, if you have got some answers, then maybe you can make a statement like this. So your title can be explanatory, interesting. Okay. But as I said earlier, because you're doing a thesis and you have not yet got the answers, maybe being a bit open, giving possibility to both the domains is a better option. Then writing the introduction. Now this is somewhere where we all fail to understand what was needed. We write a lot and a lot. Introduction has to be crisp, to the point. Introduction should be related to your study. For example, the example that I quoted earlier, application of IFT versus ultrasound for pain management in patients with knee arthritis. Okay. The introduction cannot start with everything about what is knee arthritis, what are the grades of knee arthritis, how knee arthritis was started, what are the treatment aspects, and blah, 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 blah. And why do you really want to talk that? Give it as a reference. Talk about your study. Always use the funnel format. That is from global to local. First paragraph, talking about the problem. Second paragraph, what is known about the domains. Third paragraph, what are you intending to do? That's it. From the broad aspect of the topic to specific why you are wanting to have this. Although there are many treatment strategies for the management of pain, IFT and ultrasound has been used clinically in a wide variety of domain. But it has not been found which of the particular modality is more effective or manages the pain better or manages the pain faster, whatever is your research question. Hence, the study is about, or hence the authors would like to study which of these two modalities help in management of a pain in whatever you want, better, faster, or longer lasting, or whatsoever it is. So come from the global to the local. That would be more specific. Again, as I said, introduction has to be short and specific. Maybe when you're writing your dissertation or thesis, maybe 2 pages, more than enough. When you're writing a manuscript, 3 paragraphs, end of it. Okay, so try not to wander around. Try and stick to what you want your readers to know. Avoid bold statements in your introduction. Such evidences do not exist, or there have been no studies on such a topic. Have you read each and every published article till date? None of us have. There are more than 6,000 articles being published per week. That is the global contribution of research. You can't possibly know everything. A researcher is doing a research because he does not know everything. So don't make very bold statements. This study will change the face of earth. We are going to do. I mean, having a bit of humility is always an advantage. Okay, be humble. It helps. So avoid unnecessary big statements also. Yes, the more you go on with it, there will be a lot of confusion. But as I said again, we will help in clarification of a lot of domains. Then we talk about conducting the review of literature. Most of us are told, okay, find at least 10, 15, 20 articles to support whatever you're doing. Try and break your study into small topics. For example, again, IFT versus ultrasound for pain management in patients with knee arthritis. Try to look at knee arthritis treatment, therapeutic aspects of management. Don't go into the surgical interventions. That's not your topic. So knee arthritis, therapeutic aspects. IFT, clinical applications. Ultrasound, clinical applications. Then try and combine all of them. So if you try and look into it, you will get what you need to look at your review of literature very nicely. Review of literature is important because it helps you to answer the foreground questions. Background questions are what you know, what you have read in the texts. Foreground questions are what is applicable in the clinical scenario. How much, what, to what extent. Answering these questions is what foreground questions are all about. Always refer through peer-reviewed index journals. You also have good databases. We are going to talk on some databases also. So look at some good databases. Look at journals that are there on databases, because if you are looking at Google, for example, Google is a search engine. It's not a database. Google will give you a lot of options. What suits you better is a different domain. Again, conducting a review of literature or searching a review of literature is again altogether a different topic. And if possible, we might have one more session on that also sometimes later. What is very important, what I just would like to give you as a quick tip, is have a knowledge of keywords. For example, I just described some time back the PICOT, PICOT format. The P, that is population, intervention, control, outcome measure. These 4 words are also your outcome or your keywords. So even if you try to use these keywords, and if you are using a database like PubMed, Google Scholar, maybe Cochrane, if you are going for systematic reviews, Sinal, Pedro, whatever. PubMed, for example, allows you fields like title, abstract, author, journal. It gives you something like booleans and or not. It helps you to identify similar terms like mesh terms. For example, you are doing something on knee arthritis. Beg your pardon, you're doing on something like total knee replacement, which is also called as total knee arthroplasty or TKA or TKR or knee endoprosthesis. So different authors might have used different terms. So mesh terms helps you get studies or literatures or reviews done better. Doing a review of literature and documenting it properly is very, very important, because without a proper documentation, your entire exercise will be a waste. Then comes the aims and objectives of your study. Why are you doing all these things? Aim is a broad goal. Objectives are its fragments. Your aim is to know which of the two methods are good. Objectives help you define that good. Good means, are you looking at faster pain management, faster restoration of function, or any other factor, whatever, which you have described. So objectives help in characterizing this good. The aims and objectives should also be clear and precisely stated, and stated in advance. You cannot add objectives later. You are doing the study, you suddenly find something interesting, you add in your objective. Sorry, not possible. It should be clear, precisely stated in advance, and objectives should be simple, smart, and as I just said, stated in advance. Smart meaning objectives should be specific. They should be measurable. You should be able to determine how much change. Objectives should be achievable. You should be in a position to actually get them. Objectives have to be realistic. No, you can't just expect anything random. And very important, objectives have to be time bound, because possibly you're doing your research project or your dissertation, and that is also having a time limitation. Or maybe you're doing a PG and you know you have to finish in 2 years. So everything has to be time bound. Then comes the research design and statistics. Again, most of us have a lot of confusion and phobia on this. But mind you guys, this is the most important factor. Chalo, let's say you write something aage piche in your introduction. No problem. You can rewrite it later again if you feel it was not good or so. But if you plan a poor study design, if you're wrong with your data collection, you have to redo the entire study again. You have to actually go to the level of collecting the entire data again. So planning your research, your designing your research is very important. And this is the most important factor. So look at what is the type of research proposed based on your study design. Is it an experimental, correlational, whatever it is? Your study design will help you look into the type of the study, pre-test, post-test, control group, cross-sectional cohort, whatever, RCT, whatever you want to do. So asking the right research question will help you design your study in a better way. It would also help you to know the samples, who should be considered, who should be taken, where should I get these people from, what should be their characteristics, who should be included, who should not be included. They will also help you realize your sample size, as we have discussed some time back. They would also, your study design would also help in getting allocation. For example, how should I do randomization? Should I do randomization as per person? Should I be using a computerized table? Should I be randomizing people into blocks or groups? How should I randomize? So that again, your research question on your design would help you understand. And that's why again, I'm repeating myself, having a good plan is very important, because if you fail to plan, you are planning to fail. So it is very, very important that you do this properly. And your research design will also help you understand statistics, because it will help you know what is the outcome measure. What is that type of data? Is it a parametric data or a non-parametric data? What statistical test should I use for this particular type of data? So if you are clear, always feel free to take help of your guide. Most of us are skeptical to talk of our guide. What would he say? What would she say? Please, your guides are your friends. They are there to guide you. They are there to mentor you, to help you, to grow you. So please always talk to your teachers, talk to your guides. They are the best friends that you have. They are just your professional seniors who have seen the profession and the field more than you, and hence will be able to tell you the rights and wrongs of things. So feel free to talk to your teachers and guides, and also talk to a statistician if possible. Because if you are involving a statistician from the beginning, You understand the processes, the data, and the tests in advance in a better way. Of course, if your guides are good, they are helping you with it, you are very lucky. If not, no worries. You always can approach a statistician who can be your team member to also help you do your study in a better way. Then there is a concept. How should I go ahead? What should I do? What clinical test should I use? Do I know how to use this? Well, always, it's my personal advice. And I think many of the teachers and the seniors would concur with this. Always do a pilot study. A pilot study would help you understand what you are supposed to do. It would help you understand the tools. Pilot study is never to look at the end of the outcome of the study. Pilot study is important to know the process, the procedure. For example, you are making a questionnaire. What questions you are asking? Are they sensible? Do they give you what you are trying to see? In research, we call it as valid. Okay. If you ask or somebody else asks, would they give you the same answers? We call this reliability. So when you are doing a pilot study, you actually establish your outcome measures, your study designs also better. Maybe you are using a tool which you do not know how to. Let's say you are using a complicated dynamometer or a skin fold caliper, which you are normally not used. Pilot study helps you understand this process, how you should be doing this particular thing, how you should be assessing it, what are the mistakes that can happen, how you can eliminate them in advance. Pilot, so as I said, it helps in rectification and finalization of the processes and the procedures. So always do a pilot study, especially before you submit your synopsis to the ethical committee, because it helps you. Yeah, one more thing, pilot study also helps you in calculating the sample size. So it is a very helpful tool. Well, how many you should take? That depends on what type of study you are doing. If you are doing an experimental study, 5-6 people would also be good. If you are doing a cross-sectional survey, some 7, 8, 10 people will also be good. It's not that you have to have a large population. Sometimes when you are doing a very rare condition, like for example, you are trying to do Parkinsonism, ankylosing spondylitis, which is not so commonly seen, having just 1 or 2 subjects would also help you understand a lot of domains. But yeah, because there's just 1 or 2, there's always a chance of personal bias also. So having a slightly more, 2, 3, 4, 5 would be beneficial. Pilot study helps in preventing any potential confounders, any pitfalls that might happen later, anything that might drop into, reduce the outcome or reduce the strength of your study. So it helps you understand. For example, you wanted to look at balance and suddenly you found while doing the pilot study that the footwear also matters. So then you decide, okay, I want to do barefoot. Or you might know that the nutritional status is also important. So you might as well know, okay, I would like to do when the person has had the breakfast, so that they are not, they do not have a giddiness or faintness also. So these small tethering issues or teething problems that we can anticipate when we do a pilot study. And yes, pilot studies are also important to get functions. For example, you want to measure quality of life by using SF36. You can get the scale, but what about the performance? What about the measurement? So it always helps to obtain these permissions in advances. There are many outcome measures which are freely available. There are many which are available, but their interpretations are paid or you require the author's permissions. That all can be achieved when you do the pilot study. So once you actually start your study, you are no way confused or no way, stuck up somewhere. Then you have your materials and methods. Now we have some part we have already talked when we talked the earlier procedures, but materials and methods means you need to lay down the detailed procedures of your data collection. For example, where are you going to collect the samples? How are you going to collect the samples? How are you going to ensure that they are across the different socio-economic or geographical domains? Most of the times we'll end up doing a study. I want to do assessment of some function in Indian population. Sample size 30. Well, 30 samples from your local area cannot represent Indian population. So if you want to do an Indian population, then your study has to be with that way across the country with that much population, or then stick to what you are trying to do. So don't be over enthusiastic. So this will help you understand what is the data collection process. Timeline. Okay, always use a Gantt chart. Making a Gantt chart will help you understand the time processes that you will require to do your entire study. Also, you will be in a position to finalize what is your safeguard or confidentiality. When you collect the data, where are you going to store it? Whether are you going to see if it is available on public domain, somebody else has an access to it, or your data is lost somewhere or so. Approaches. How do you really go ahead with doing your study? Where do you really want to do, or what do you really want to do? And justify the use of approach to answer the research question. So this preparation will be also very important. Materials and methods can also help you understand what sort of observations using your outcome measures also. What documentation? How do you maintain the study validity? Okay, all these factors will be answered once you are clear with your procedures. Well, if you are not very clear of how you have to approach this, sometimes, let's say you are doing a study for the first time and you really don't know, okay, how do I really know, okay, what I'm doing is right or wrong, whether I'm going on the right track or right path. There are certain universal guidelines that are available. For example, if you are doing an experimental study, follow the consort guidelines. If you are doing an observational study, you have the stroke guidelines. If you are doing study for diagnostic accuracy, you have the START guidelines. There is something called as the tripod for prediction models. There is something called as a PRISMA guideline for systematic reviews. Or for case reports, there's something called as a CARE guidelines. Of course, these are not everything. There must be more, definitely. And there are a lot of experts who will be more than happy to contribute, or more than who might know a lot more than this. And we definitely from PhysioTV invite these experts to also help our students to give a wider perspective of these research domains. Then very, very important factor in each and every study is ethical clearance and registration. It is mandatory that all of us first get the departmental clearance from the departmental review board, then the institutional clearance where you have interdepartmental aspect, that is what we call as the institutional review board, and which, so basically DRB and IRB will help you formulate your methodology, procedures, outcome measures, all these details into a better way. But what is equally important is your IEC, Institutional Ethical Committee approval. IEC looks at what you are doing is in a better way or no, whether you are safeguarding the rights and the dignity of your subjects. Okay, I suggest everybody to do GCP certification. It is but naturally mandatory to do GCP certification if you are doing any research project. There is an entire session on GCP which we'll be happy to take if possible, but there are better guidelines, there are better workshops that are conducted across India from very good organizations, authentic sources. So we will limit ourselves to taking from GCP, but please, it's a request, do a GCP workshop for you to understand what is supposed to be done in the research. Follow timelines. We just talked about duration. Yeah, one more important factor is the budget, costs. Are you having any external fundings, or are you going to get funded by your own self? So if you are spending out of your pocket, you need to know what are the sort of expenses that you're talking about. Taking printouts, equipments, for example, you require to do taping or so, the cost of the tape. Is your institute supporting you for the components, or you have to shell it from your own pockets? Are you getting a sponsor, or how are you going to work on this cost? So this is very important to be stated in advance, so you know what sort of amounts you're looking at. We have already talked about confidentiality and data storage. And again, very, very important for all of us, please register your study once you have got the ethical approval with our National Clinical Trial Registry, that is CTRI, Clinical Trial Registry of India. Even physiotherapy studies, even observation-based studies, all can be or should be registered with CTRI. CTRI is our national depository for research. And when you are registering, you are not only safeguarding or protecting your study, you are also helping to propagate what we do. See, understand, so many of us doing so many studies, and this should be documented, or this should be put forth to our government that these are the amount of studies that we are coming or that are coming from our country. So please, please, please register your study after you have got your IEC approval. Please register your study with CTRI. Then the master chart. Now, why am I talking of the master chart right at the beginning? Now, master chart is something that you tend to do at the end. And the problem is when you are looking at making the master chart in the end, there's a lot of work that is piled up right at the beginning. So whatever outcome measures, let's say you're doing a pre and a post experimental study, or you're doing an observational study using a questionnaire, whatever you're doing, once your basic synopsis domain is ready, start making your master chart. At least open up an Excel sheet or a spreadsheet and start preparing on what headings you want to do. Because whenever you start getting your data, please start entering into it. Remember, let's say your sample size comes to 300. And then when you get all those 300 forms, you have to sit with coding of them. You have to sit with entering of all these details. And if something goes here and there, your study goes for a toss. So as and when you start collecting your data, maybe you do your pre-assessment, you're doing your intervention, then you're going to do a post-assessment. Try to enter all this data in your master chart as and when you can. Don't wait for the last moment. As I said, using Microsoft Excel has been very helpful to many of us. Even spreadsheets are important, or you might do it on directly the Google Drive, whichever you prefer. But Excel, essentially, why I would suggest, maybe because I have used it a lot, it gives you a lot of options, including formulas for calculating average or standard deviation or summation, or there are in fact statistical tests that can be done even in Excel. Most of your parametric data analysis is even available in Excel. You do not require any other software. And yes, as I said, master chart, why? Coding is also important. So you can actually have a master chart where you have names and codes, and the master chart that you are going to submit later with only the codes, so that you protect the identity of your study participants. It is not available on some public domains. Last but very, very important, always avoid scientific misconducts. Somewhere or the other, these are the things that tend to happen. Maybe, as I said earlier, the research is something which requires a lot of sincerity, dedication, and hard work. And we kind of tend to be lazy at times. So that's where these things start entering. Falsifications, making castles in air, building up false stories. Please never ever do anything of this. Fabrication of data, manipulation, never. And plagiarism, copy pasting somebody else's ideas on your name. We tend to do it. Most of us invariably, how do we prepare our introduction? We read at 3-4 articles, copy one statement from your page, copy from somewhere page, copy. This is not how you do it. What did you understand about it? Did you understand it? If you have understood it, try and write in your own words. If you are quoting somebody, give appropriate references and credits to them. You cannot claim somebody else's work as your own. It is wrong, it is illegal, and it is very immoral. So please do not be indulged into any of these misconducts of creating false data. Many a times it tends to happen. Your tenure is about to get over. Your study has been completed to hardly 20-30%. And all of a sudden, in the last 1 month, you finish with the entire data. You have got 20 out of 100, copy paste 40, copy paste 60, copy paste 80. Well, your guides can easily catch you. And if any of us finds out that any of you is doing something of this, the loss of trust and faith that will be encountered will be immense. Not to understand professionally, it will be a disgrace to you. So do not get involved with anything like this. We tend to feel at a postgrad level that, our guides don't understand things, or Don't think about it. Most of us, or rather all of us, have gone through all these processes. We understand. If you have difficulties, as I said earlier, talk to them. Okay, have that element of trust between you and your guide, so that you can always approach them whenever you are in a need for it. Never ever get involved with any of these malpractices. Finally, when you are doing the study, of course, this is not part of the initial synopsis, but when you are doing a study, results, discussion, and conclusion will be part of your study at the end of everything. Results will generally talk of the procedural outcomes, your pre and post, or your findings, or whatever you are trying to do. It will talk of what your study data is. Discussion talks of why you have got that finding. Discussion has to rationalize your results. Okay, so you have got treatment A. Again, our example, IFT and ultrasound. You have got IFT is better than ultrasound. Why? Have other people who have done similar studies also got the same? If they have got something else, why have they got it that way? Was there anything different in their studies compared to you? Try and justify this. Do not manipulate. Never ever prove something just because you are trying to prove, and then I don't know why I've got these results. No, try to find out. There must be some reason. There must be cellular reason. There might be neurological factors. There might be multiple factors that can be. There might be a patient-based factor. The perception of giving an electrical stimulation, which I feel, versus an ultrasound where I do not feel anything, which may help me feel that the IFT stimulation was better. There can be any cause. Try and analyze it. Your discussion has to rationalize your findings. Look at confounders. We have already talked of what are the confounders earlier. And finally, the conclusion, which is an amalgamation. Your conclusion can be as good as your hypothesis, or it can be your null hypothesis. It's okay. It's okay if you wanted something to happen and it is not proved. That's fine. That's still a study. It's always said that when a discovery was made, or when any discovery was made, none of the scientists were always successful in the first attempt. Okay, but people always understood procedures of not to do something in the right way or the wrong way. So it is okay not to have your hypothesis being accepted. Sometimes your hypothesis can get rejected. It's still a study. Don't get dejected. Don't get depressed if what you wanted to think about it, because as I said, research is all about 50-50. If this 50 is not true and this 50 is true, it's still okay. It's still the same. What if I wanted to prove that this was better, but this turned out to be better? That's fine. Okay. So never get disheartened with any of these domains. Be truthful. Be truthful. That is what is more important in research. And finally, writing the references, because still this we take a lot of efforts, but when it comes to actually writing references, we tend to be ignorant. Again, references should be written in a very good domain or format. Our university generally prefers the references to be sent in Vancouver format. Many universities, I believe, prefer the same. But when you are writing manuscripts, maybe there are different formats like the Vancouver format, the APA format or so. People might have different domains. So you can have the name of the author, the title of the study, then the journal where it is published, the year of publication, then volume, edition, page numbers. If your study is published already, you might get a page number. Sometimes some studies, for example, the first example, the study was published and it has an E number. The study number, example number 3rd, it was published ahead of public. It was available ahead of publication. So you might have something like an AOP. That's fine. That's fine. You can still quote it. But when you are giving references and you are using it from the internet where you're trying to find out certain studies, please ensure you give the entire URL. You give the entire URL and in bracket viewed on what date. Because tomorrow, if the site is changed or something, it should not be a problem to you. So give the proper URL. You can quote books, you can quote chapters, you can quote any sources. Any of your level of studies can be quoted as long as they are given reference properly. So finally, to summarize our entire domain, as I said earlier also, research has now become an integral part of all of us, right from a clinical practitioner to an academician to anybody. Basics of research are very important to be understood by all of us. Finally, any research is completed only and only when you publish it in a good peer-reviewed index journal. Again, we have an entire topic on how to write a manuscript and submit it for publication, and if possible, we'll take that also at a later date. But there are ways. Again, most of the steps and sequences are very identical to what we have done, but please ensure that you are publishing your manuscript, because we need to. It is our moral responsibility to add this into the existing literature. You have done something good. How will people know what good you have done unless you are not publishing it? Again, it's okay if you are publishing it even as a closed access rather than an open access. It's fine. It's fair enough. But please ensure you are publishing in a reputed and peer-reviewed journal, preferably always, which is either in UGC care list, and better if it's on a database like PubMed also. There are very, very, very good Indian journals which are not there on PubMed, but they are very nice. They are on UGC care list. So please be careful, be observant which journal you are taking. Okay. Again, as I said, always study should be done in a truthful and honest manner. There is no shortcuts. There is no cheating. There is no nothing. It is all about dedication and hard work and understanding of what you are trying to do. So only when you follow all these domains, that is the final true contribution to your professional growth. As a clinician, of course, you are serving mankind. You are doing good for others. As an academician, of course, you are doing good by bringing up the next generation of professionals. But if you really are contributing to the professional growth and development, be involved in the research also, because that is the only time when we can upgrade our profession, our physiotherapy. These are few of the references that I have used for making this particular presentation. I thank all the authors for their excellent work, and thank you all of you for your patient listening. Please feel free to write to us. You can put the queries on your chat box, or please feel free to write to us at physiotvofficial@gmail.com. We will definitely try to answer your queries or your questions. But you have better people with you, your guides, your teachers. Try and talk it out to them first. Okay. So thank you, all of you, and have a wonderful day. Take care and God bless you all.